Capstone, Can You Stand It? A comparison of vertical ground reaction force in patients with osteoarthritis. My contact information is on this slide and will also be on the bottom of every other slide. To begin, I would like to acknowledge the following people who have helped me and supported me and given me guidance throughout the last year on my project. My mentor, Dr. Stephen Lapsley, my committee chair, Dr. Loman Bonfiglio, my third member, Dr. Capin, as well as Amy Peters, Dr. Salcedo, and Andrew Hull, and of course the entire Modern Human Anatomy program, specifically Jennifer Thurston in my class of 2021. To begin, we're going to be talking about osteoarthritis, also known as OA, which is a degenerative disease of cartilage in our joints. It is found in any joint in the body, however, it is most likely in the hands, hips, and knees. And for my project, I focused on the knees. So in this figure to the right, you can see picture A shows normal joint space. There's cushioning from cartilage and space between the femur and the tibia. And then figure B shows a loss of this joint space with bone-on-bone connectivity and a degeneration of that cartilage. This condition can cause lots of pain and decreased functional ability and can make it harder for patients with this condition to do daily tasks. It affects over 32 million US adults, and it affects more females than males. And it can lead to something called weight-bearing asymmetry, where patients will favor the limb most severely affected by osteoarthritis. And when I say favor, I mean that they are placing less weight on the more severely affected limb, and they place a greater load on their uninvolved limb. So previously, weight-bearing asymmetry has been studied in functional tasks such as quiet standing, sit to stand, step up, and gait. For my project, I focused on quiet standing. Weight-bearing asymmetry is measured via vertical ground reaction force, which can be seen in this image to the right. These blue arrows represent vertical ground reaction force for each limb. And to capture this, patients stand with each foot on a different force plate so we can get different readings. However, patients do not know that they are standing on force plates, which is how we can capture their natural stance. This patient's uninvolved limb is their right side, with this blue arrow going all the way to their rib cage, compared to the involved limb of their left side, where the vertical ground reaction force goes just to their pelvis. And the difference between these arrows is showing that weight-bearing asymmetry. Studies that have previously looked at weight-bearing asymmetry in terms of quiet standing have approached these data either by averaging an entire time sequence or averaging just a specific section of the trial. And when I started reading about this, I just thought it was kind of funky that there were two different ways to go approach the same data. This study rationalized averaging just the middle 30 seconds by patients needing time to find a steady state, and then they also expected an anticipatory response at the end of the trial. However, my project was focused on variation within these trials themselves from beginning to end with weight-bearing asymmetry and if data should be looked at in a different way. So the objective of my project was to determine if there was a change in vertical ground reaction force or weight-bearing asymmetry within these quiet standing trials, as well as to determine the degree at which weight-bearing asymmetry exists in 90-second quiet standing trials in this patient population. My hypothesis was that when comparing the forces produced in 90-second standing trials, the last 30-second block would show the most asymmetry compared to the beginning or middle sections. And this is because patients would start to exhibit more increased levels of pain, as well as increased muscle fatigue of their involved limb as the trial progressed, and would place more weight on their uninvolved limb. So to do this, I had 77 participants that were all a part of a different ongoing study with the physical therapy department at CU Anschutz. They're all about to undergo a total knee replacement, or a TKA, of their involved limb and have not previously had a TKA on their uninvolved limb. I use this ratio, weight-bearing symmetry ratio, where you take normalized and averaged vertical ground reaction force of the involved limb and divide it by normalized and averaged vertical ground reaction force of the uninvolved limb. And I did that for each of these different sections. I obtained data via Vicon Nexus and Visual 3D, and then worked primarily in MATLAB for all of this. My results showed that I had 58% female, 42% male, with an average age of 65 years old for my participants, and that weight-bearing asymmetry on average for all participants was about 86%, favoring the involved limb regardless of time. That is shown on this graph to the right, where we have normalized vertical ground reaction force on the y-axis and percent of trial on the x-axis. This top red line is our uninvolved limb, and the blue bottom line is our involved limb. And this 86% basically means that there is a 14% weight discrepancy between limbs, so they're placing 14% more weight on their uninvolved limb than they are their involved limb. And that's seen here with this uninvolved limb having a higher rate of vertical ground reaction force and the involved limb being lower. However, between groups, there is no significant difference in weight-bearing asymmetry. So these lines are fairly consistent throughout the trial, even though this is just vertical ground reaction force. On this next slide, we can see these are mean values for weight-bearing asymmetry throughout each group. So 0 to 30 seconds, 30 to 60 seconds, 60 to 90 seconds, as well as the entire 90-second standing trial. They vary slightly from 0.86 to 0.873, but not enough to be significant. So in conclusion, there's no significant differences between time segments. My hypothesis is rejected. But as we knew from our background information, weight-bearing asymmetry would be present in this population, with most patients distributing less weight on their involved limb. And this is most likely due to a habitual stance. So when patients were asked to stand in a quiet stance, they assumed this position right away, which suggests this is their new baseline for how they distribute their weight. In the future, I would like to look at post-operative TKA data to see how weight-bearing asymmetry changes after a total knee replacement, since this is a habit now, as well as longer quiet standing trials to see if there's a threshold of time at which this habitual stance and baseline is overcome, where patients will start to overload their uninvolved limb even more. And then I'd like to look at this habitual loading pattern in everyday life. We just got a 90-second snapshot in lab. However, it'd be interesting to look at over 24 hours or over a week if the level of asymmetry patients show is consistent. Thank you. Any questions?
Excellent, great work. Any questions for Eliza? So I do have one question. So from the prior literature, was there any indication that a certain length of time would have allowed you to see those differences?
No. Oh, sorry, continue.
Oh, done.
No, I was looking for literature when I was trying to figure out some future directions to see if a longer quiet standing trial would show that, and I couldn't find anything. So I still think it would be interesting to look at.
All right, no questions in the chat so far, just a lot of congratulations. All right, so I think any questions, anyone want to unmute and ask a question? Otherwise, I'm going to move on.